I've been in the Medicare business for over 15 years now, and I have many clients that are retired doctors, primary care doctors, surgeons, specialists, anesthesiologists, those that are physician assistants, nurse practitioners, nurses, as well as many that are just administrative roles in the healthcare profession. And not one single time have I had one of them enrolled into a Medicare Advantage plan. In this video, I'm going to share with you 5 reasons why many doctors hate Advantage plans. And then I'm going to give you 5 real examples at the end and show you why. All right, so we're going to get into these reasons why many physicians can't stand Medicare Advantage plans. And of course, you can see the first one would be administrative burdens. Now, I want to explain what I'm going to do during this video. Number one, we're going to talk about really how the MA plans work as it relates to these items that, again, doctors struggle with. And then we're going to show you why it's so important. And then thirdly, we'll make a comparison between how the original Medicare and supplemental system would work versus the Advantage plan. That's going to be kind of what we're going to follow. That'll be my pattern during the video. So when we talk about administrative burdens, there's actually 2 of them that are cumbersome for doctors. So let's look at the first one. The first one would be prior authorizations. Prior authorizations. This means there's some kind of a service that is expensive, that the plan requires approval. Doctor recommends, but plan must agree with what the doctor is suggesting being done. So actually, the insurance company has final say-so on the prior authorization. So let's talk about how it works with the MA plans. So with MA plans, doctors must get prior approval on certain services, okay? And that includes many treatments that would be necessary, tests for sure, surgeries, inpatient or outpatient, post-acute care. So this means someone needs to go to a skilled nursing facility, maybe after a stroke or an injury or an accident or a certain illness. And so post-acute care, very expensive, of course. And so that is certainly a pre-approval item. The plan may only want to cover for 15 days. If you have to stay beyond that, then that's going to have to be pre-approved. And so that can be healthcare that's subject to their approval insurance company. But notice the statement here. And even with some medications, okay? So not just healthcare service, but meds as well. So that's the prior authorization process. So the question is, why is this such a problem for doctors? Well, here's why. This problem is prior authorizations delay patient care. In other words, this process of going through the prior authorization delays care and also takes additional staff and time. Costs the doctor money. In fact, they say the average practice today has to have about 2 people on their staff just to take care of prior authorizations, as well as when a prior authorization is denied, that appeal process against staff and time as well. All right, so that is an issue. Now, as we compare this in the Medicare Advantage system, let's compare it to original Medicare. Notice this. With the original Medicare and the supplemental plans that you have, prior authorizations are what? They are very, and I mean very rare. In fact, sometimes really just even non-existent, okay? Why is that? Well, because healthcare needs are not deemed to be necessary for prior authorization. Why your healthcare needs then are provided, or they proceed more efficiently in that system. Why? Very little, if ever, would you have to have prior approval by Medicare. The insurance companies never, but Medicare rarely as well. Okay, so there's a difference, and that's why it's so problematic for some doctors. Now, the second administrative burden would be this. That would be paperwork demands. Lots of paperwork required with these plans. And so with the MA plans, to understand how this works, each insurance company, notice this, has its own policies and its own paperwork requirements. All right? And so right now, there are actually about 3,800 Advantage plans available throughout the country for 2025. They say the average market has 43 different plans. Now, of those 43 plans, there's going to be anywhere from usually 10 or 12 different companies providing those plans. But here's the point. Each of those companies and all their different plans, it's going to have its own policies. There's no consistency there whatsoever. It's really whatever the insurance company wants to impose upon the doctors and the providers. And so different requirements, very cumbersome as a result of that. So the question is, well, why is this such a problem? Here's why. Because the inconsistency in the process creates, again, delays in needed care and sometimes denial in the delivery of the care, problems there, but also in the billing. These doctors' billing departments had to be familiar with all these different rules and requirements. And again, that's difficult. All right, now let's compare that to original Medicare with your supplemental plan. And that would be this. The process is what? It is uniform. And it is really, quite frankly, very streamlined. Right? When you pull out that Medicare A and B card, it doesn't matter where you are in the country, they understand that system. They understand that very simple process. You pull out your supplemental plan, same thing, because the billing goes from the provider to Medicare A and B. They pay their part and take the balance and send it directly to that Medigap insurance company. So again, that's what makes it very streamlined. So it's not cumbersome. It's not dictated by the insurance company. It's really dictated by the way the Medicare system works. All right, that brings us now to the second reason why some doctors hate Advantage plans, and that's this: because of the lower amounts of money and delayed reimbursements. All right, so let's look at the details on this. So with MA plans, the doctor is paid less, okay, and usually less timely. In other words, a little bit slower. They say right now that Medicare Advantage plans reimburse doctors for at the rate of about 85% of what they would have received in the original Medicare system. Plus, Medicare pays quickly and supplemental plans pay quickly as well. And so they're going to get their money a lot faster also. Okay, so that's problematic for sure. And so the question is, why is this such a big problem? Well, because what does it do? It affects cash flow. Doctors' offices and hospitals are businesses. They certainly care about cash flow. And it also increases financial stress, especially for some of your smaller to medium type practices. So when these MA plans are low pay, slow pay, that can be, of course, an issue for sure. And then number three, as we make this comparison to original Medicare, what happens? Doctors are paid more. Like I said, that reimbursement rate on the Advantage is about 85% of what they'd get on original Medicare, and it's also more quickly. Turnaround time, very fast. That provider makes a claim with Medicare. Medicare, they say, pays usually within a couple weeks, goes directly to the insurance company, and again, they're going to pay within about a week or so of receiving that claim. All right, so again, much better for the doctor. That brings us then to reason number three, and that would be this: network restrictions. Network restrictions. So again, let's talk about MA plans. With the MA plans, doctor options, or we could say doctor choices, can be very limited. Very limited. All right? Why is that? Well, because we have networks. We have networks that are called HMOs, and we have networks that are PPOs. And again, if we didn't have networks, we wouldn't have Advantage plans, because it's the only way that they work. These private health insurance companies make these plans work because they enter into contracts with healthcare providers, doctors and hospitals and surgeons and durable medical equipment providers who agree to get a certain rate for the services that they provide. And so they're going to enroll into either what we call the HMO network or the PPO network. And so what happens when I enroll into a network, if I have an HMO, it's definitely going to be a smaller network than the PPO. And again, many of the plans today are HMO. And so what happens is the reimbursement rates are lower on the HMO than the PPO. Now, the HMO insurance companies say, well, we'll give you more quantity, more volume of business. PPO, they make a little bit more money for sure. And so there's some doctors that don't like the low reimbursement rate in HMO. So they may say, I'm not going to take that at all. I'll just take the PPO. Okay, so for you, the consumer, that's why it can be limited in choices. Another issue would be if I want to go over here and I want to go out of network and I'm on an HMO plan, okay, you can't go out of your network. That is not an option unless you want to pay for it out of your own pocket or pay more for it. You have to really stay within that network unless it's an emergency or an urgent care situation. All right, now on a PPO, you can go out of the network. The problem is it costs you about twice as much to do it. So you're better off, again, if you stay within the networks. Now, it doesn't mean to say networks are bad or that you can't find sufficient amount of doctors, but again, it's going to be less for sure than it would be if we compare that to original Medicare. All right, and so the whole issue that some doctors struggle with are going to be these networks, because they like to make a referral and they may want to refer you to a certain specialist that's not within your network. All right, so that brings us to number two. Why is this important? Again, patients may not be able to see certain doctors. They may want to go to a certain oncologist if they get diagnosed with cancer, but the doctor may not be in the network, or a certain surgeon not in the network. That's problematic. So they could see those doctors, but they're not in the network unless they do what? Switch plans. And we see a lot of people having to switch plans to get their providers covered, or the worst case would be this: they have to pay out of pocket for those expenses. Okay, so one more thing as we compare these plans with Original Medicare. Original Medicare, notice this: their folks are no networks at all. We call this an open access system. You can go to any provider, any hospital, any doctor that takes Medicare. 100% of all hospitals take Medicare, and 99% of non-pediatric doctors accept Medicare. All right, so we don't have to worry about networks. Notice this: 99% of all non-pediatric doctors are going to take Original Medicare, and therefore they must and will accept all Medigap policies. Remember, Medigap and Medicare supplemental plans, that's synonymous, so they're going to take the plans. They take Medicare, they will absolutely take any plan that you choose. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, before we move on to reason number 4, I actually put together a graph for you because I thought it would be very helpful for you to have a visual of what I mean by the networks and the limitations sometimes that you'll have with providers, okay? And so let me show you this graph and explain to you exactly what it means. And so we're looking at a network, and this would be the average network in a metropolitan area. We look at all the doctors that are available in that area, primary care doctors, specialists, surgeons, all that. They're available. So this would be 100% of all the doctors that are in that area. And so what happens when I enroll into an Advantage plan, notice this: there's a 22% chance that I actually will have a fairly large network, because all the doctors here in green I can go to. So that's 70% of the doctors I can go to. 30% of the doctors I can't go to. Those are X'd out for me. And so there's a 22% chance that I'm going to have a network that looks just like that. So less than 1 out of 4 networks in a market is even going to have that many doctors as choices for me. Okay, so again, that is not the norm. Let's look at a second option here. Again, these are studies that have been done recently looking at networks. So again, all the doctors that are available in that in that area. Notice on this one, I can only go to 30% of the doctors that are going to take the plan. That means all these others are not even an option for me whatsoever. That's a very small network, and that's going to happen. Look at this. 35% of the time, over 1/3 of all the Advantage plans available to you, that's what your network is going to look like. All right, there's another one. This is about the best it goes here, and this represents about 43%. So almost half of all the plans available to you are going to have 50% of the doctors that take the plan and 50% that won't. So again, these are off limits. And these over here, you actually could go to. All right, so that is going to be more of the norm. So again, doctors do not have to enroll in these plans. It is totally voluntary. Some will, some won't. Okay, one of the difficulties we find, if you have maybe 4 or 5 doctors, it's difficult to find one plan that all those doctors are going to take, because it is very rare for a doctor to take all the plans available. Now let's compare that to Original Medicare. So here's what it looks like. Remember, 99% of all doctors are going to take Medicare, so you almost have unlimited choices. You got 1% that don't, and they say that about half of those are actually psychiatrists. So the majority of doctors will be available to you. So you have to decide, are you interested in networks and the limitations that come with them, or would you rather find almost any provider that takes Medicare will be an option for you? All right, so here's the bottom line. About 50% of all doctors will accept some type of a Medicare Advantage plan. All right, so it can be difficult, if we have a lot of doctors, to find a doctor that will take all of the plans that are available. All right, and so that's why networks are a huge, huge deal. And so the question is, why is this? Why is it that more doctors will not take the Advantage plans than what we're looking at here? Why don't they treat the Advantage plan like they would over here, Original Medicare? Well, let me tell you why. Okay, here's what's happened. These are recent studies out. And what we have here is a summary of how Medicare Advantage plans create friction for doctors, troubles, problems that come about. And so they went through and they categorized the different types of doctors and really the complaints that they had about Medicare Advantage plans. All right, so here are primary care doctors or primary care physicians. Here's what they report. Their experience has been heavy paperwork, prior authorizations for basic medical tests, difficulty getting referrals approved, and low reimbursement rates. Now, for cardiologists, those who specialize in cardiology, their experience is this. They have delays in imaging, stress tests, echocardiograms and such, and denials for cath lab procedures or post-stent medications. That's a problem. For oncologists, here's what they experience. Denials of PET scans. MRIs and CAT scans are a little cheaper, but the PET scan's more expensive. So they have more denials of those. They have denials on expensive chemotherapy regimens or immunotherapies, and can delay or deny life-saving care, is what oncologists report. Orthopedic doctors, they experience delays in getting MRIs or surgeries approved, joint replacements approved. They have denials of rehab or physical therapy on a regular basis. Okay, those that are in the mental health care field, for mental health care needs, they experience from the MA plans, they have very limited psychiatric networks, long waits for therapy, and prior authorizations for psychiatric medications. And then lastly, just some common geriatric practice needs, those who are taking care of the elderly. MA plans have strict limits on home health care services and skilled nursing facilities. Listen to this, even when patients clearly need some more support, okay? And so the whole point is, clinically, it looks like they need this, and yet the MA plan may deny that particular care. So again, that's the reason for the limitations on the networks. All right, that brings us then to reason number 4, and that would be more denials of care. All right, so for the MA plans, recent studies done by different organizations as well as the government as they audit Advantage plans show that denials for care occur more frequently than in the original Medicare system. In my own practice, I've had people that needed a knee replacement, and the insurance company said, no, you're going to go to therapy for 6 months before we will consider the knee replacement. Or someone needed a full hip replacement, and the carrier said, no, we will not pay for a full hip, but we will pay for a rod as part of the surgery. And that was it. Okay, so those kind of things happen much more frequently in the original Medicare. And so the question is, why is this? Why is this such a problem? Why is this such a big deal to docs? Well, here's why. Because doctors, notice this, please. Doctors' recommended treatment plans can be, again, delayed, put off for a while, or denied. Same thing. But why does this matter? Because potentially harming patient outcomes. And I've got a couple of real-life examples I'm going to share with you in just a couple minutes to show you how critical this whole issue is of denials of care. Okay, let's compare this now to original Medicare. And so with original Medicare, and again, your supplemental plan, what happens? Your doctor and Medicare are going to make all the health care decisions. There's 2 rules when you're on Medicare and a supplemental plan. Number 1, ask every provider, do you take Medicare? And you're going to ask the provider if they're recommending a surgery or a procedure or a test. You're going to ask them, now, is this covered by Medicare? And so what's going to happen? Again, your doctor and your Medicare are making all decisions. You don't have to see if the insurance company agrees or approves at all. Why is that? Well, because Medigap companies cannot interrupt or stand in the way in any way, or interfere with the delay or a denial. They can't interfere or interrupt with any Medicare covered service. Again, if Medicare says they'll cover it, doctor says you need it, end of story. There's no Medicare supplemental plan involvement whatsoever in that decision. In fact, many of the companies even put on your insurance card, no pre-authorizations required. If Medicare says they'll cover it and doc says you need it, again, you're going to get that procedure, that surgery, that treatment. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us then to reason number 5, and that would be incentives that could undermine care. Let me explain what I mean by this. With MA plans, they have what we call utilization management tools. These are tools that the government allows private health insurance companies to use as they make decisions about your healthcare needs. And so these are tools they do use. One of them would be step therapy. Step therapy means that you may need a brand name medication, but there are some generic equivalent or generic alternative meds available. You're going to have to try those first. If they don't work, then they will step you up into the brand name medication. And then we have quantity limits. This would be quantity limits of services. You may have a knee replacement, and the Advantage plan says we're only going to cover so much therapy. And so they can place those limits on the services for sure. We see it all the time. And then rigid algorithms. Very sadly, the algorithms, AI, and the computers deciding how long you get to stay in that skilled nursing facility, regardless of clinical evidence, regardless of the judgment of the doctor. If the algorithm says with that disease or that issue, we're going to cover you 15 days in skilled nursing. After that, you're done. You're going to have to go home, regardless of what the doctor would say. It's rigid algorithms making those decisions, okay? Now, so what happens? These tools tend to do what? Prioritize cost. Now, I'm not saying cost is unimportant, but it certainly should not be the priority whatsoever, but it is oftentimes with Advantage plans. So again, very frustrating to a doctor, all right? And so they tend to prioritize cost savings over patient-centered care. It really should be all about the care, not about the cost. All right, so why is this a problem for doctors? Well, here's why. Because docs often feel that their clinical judgment, is what? It is second guessed by the insurance company looking to do what? Cut cost. Again, sometimes it's cost over care. All right, so what are they doing? They're trying to cut those costs. And so, again, they're going to have to approve the doctors, second guess the doctors. And doctors, of course, are annoyed by this. Your doctor goes to 4 years undergrad, 4 years of graduate school to become a medical doctor, and sometimes even beyond that to get a specialty. So they're well educated. They know what they're doing. And so in order for some procedures or surgeries or such to get approved, paperwork has to be submitted to the insurance company, who now has the final say-so. Not the doctor, who understands, what the patient problem is and what the solution is. But now we have an insurance company that must agree and approve, or we don't have care. So, like one doctor said, who's really practicing medicine here? The insurance company overrides me in some of these decisions. That's what happens sometimes with the Advantage plans. All right, now let's compare that again to MedSups and original Medicare. With original Medicare, what happens? It is the needs of the patient. Their needs that are the priority, not the profit of an insurance company. All right? And so we don't want profits overriding patient care. And again, in the original Medicare A and B, the system is not going to allow that because insurance companies, again, have no say-so whatsoever. All right, so those are the 5 main reasons why doctors, at least some doctors, are going to hate Advantage plans. 5 of them, okay? First one we saw, administrative burdens, lower and delayed reimbursement rates, network restrictions, more denials of care, and then lastly, incentives that could undermine care. And so all of these things happen on a daily basis. And so what I'm going to do just real quickly as we close this out, please stick with me. This is important for you to hear. And that is this. We have some real live examples of these things actually happening. All right, so what I'm going to do is give you the situation. I'm going to tell you about it and give you the problem, the result, and then why, again, it matters. So the situation first I want to share with you was a patient that was diagnosed with early stage breast cancer and had her oncologist recommend a PET scan, right? Not an MRI, not a CAT scan, but an expensive PET scan, and immediate chemotherapy. Well, the problem, the MA plan denied the PET scan, citing lack of prior authorization, even though traditional Medicare would have approved it. Right? So what's the result of this particular situation? The treatment was delayed by weeks as the doctor's office appealed the denial. The patient's cancer progressed slightly, increasing the risk and complexity of the treatment. And so why it matters? Because timeliness is critical, especially in cancer treatment. Denials or delays can change prognosis significantly. All right? Number 2 situation was a 70-year-old man, true story, who had a cardiac catheterization that revealed a major blockage. The cardiologist recommended a stent. Well, the problem was the Medicare Advantage plan initially denied the procedure, saying this: they wanted more documentation, even though the patient was already on the table in the cath lab to show that there was blockage. Result? Well, here's the result. The patient had to wait overnight for approval, increasing the risk of a heart attack and creating emotional distress. Well, the question is, why does this matter? Well, because acute care decisions can't always wait. Medicare Advantage plans' slow or inconsistent approval systems can jeopardize patients who are in urgent situations. All right, situation number 3. A primary care doctor referred a patient with severe depression to a psychiatrist. Well, the problem was the Medicare Advantage plan didn't have any in-network psychiatrist with availability for 2 to 3 months. Remember, limited networks. The result, the primary care doc had to manage the patient's mental health with limited resources, increasing the risk and stress on the patient. Why it matters? Well, behavioral health networks are notoriously narrow in many Medicare Advantage plans, making access to timely mental health care very, very difficult. All right, now situation number 4. I'm almost done. Listen to these 2. After a hip replacement, this situation, a patient's surgeon and hospital care team recommended 2 weeks in a skilled nursing facility for rehab. The problem? The Medicare Advantage plan only approved 3 days, not 2 weeks, but 3 days, claiming the patient could recover at home. The result? The patient goes home, falls at home, and was readmitted with a hip fracture. Why it matters? Medicare Advantage plans are known to aggressively manage post-acute care, often undercutting recommendations from discharge planners and rehab specialists. Last scenario. Situation number 5, a small independent primary care clinic in Texas found that their Medicare Advantage claims were being denied for lack of documentation despite submitting full chart notes. The problem? Each claim required phone calls, resubmissions, or appeals to get paid. Well, the result, the clinic hired an additional billing staffer just to manage Medicare Advantage plans and still lost money on certain patients. Why does this matter? Because many small practices don't have the financial or staff bandwidth to chase down every payment. So these things, again, occur every single day. And so when a person makes a decision to go with a Medicare Advantage plan or a supplemental plan, there are always consequences, and doctors are aware of these consequences, and that's why many of them really dislike and even sometimes hate Advantage plans.